Okay, so welcome everyone and to today's webinar on what promises to be a very thought-provoking and timely topic. And as we begin, I'd like to start with a land acknowledgement. And I invite attendees to put in the chat where they're joining us from today. The CHEER project is housed at Queen's University, which is situated on traditional Anishinaabe and Haudenosaunee territory. To acknowledge this traditional territory is to recognise its longer history, one predating the establishment of the earliest European colonies. It is also to acknowledge this territory's significance for the Indigenous peoples who lived and continue to live upon it, peoples whose practices and spiritualities were tied to the land and continue to develop in relationship to the territory and its other inhabitants today. The Kingston Indigenous community continues to reflect the area's Anishinaabe and Haudenosaunee roots. There is also a significant Métis community, and there are First Peoples from other nations across Turtle Island present here today. I would also like to thank video conferencing services at Smith School of Business for providing the platform and technology, and Jason Miller for supporting the event today. And just as a reminder, this webinar will be recorded and available on the CHEER website. And for those of you who may not know about the CHEER project or would like to learn more, the Canadian Collaboration for Child Health, Efficiency and Excellence in the Ethics Review of Research, CHEER, is a Canada-wide initiative on a mission to improve child health by streamlining research ethics review for child health research. CHEER is led by Clinical Trials Ontario and MyCern in partnership with Queen's University Faculty of Health Science, Office for Professional Development and Educational Scholarship, and investigators and collaborators across the country. CHEER is a CIHR grant-funded project, in fact funded by the institute that Dr. Chambers, one of our speakers here today, is scientific director of. And as part of this project, we have an educational component that aims to provide educational opportunities for researchers, administrators, REBs, patients and families to support high quality and efficient REB reviews. So this is a very lovely opportunity to have this event today with Dr. Chambers. And you can find us online at cheerchildhealth.ca. Now it is my great pleasure to introduce today's speakers. Joining us is Dr. Christine Chambers and Emily Grunwald. Dr. Christine Chambers is an international leader in the study of children's pain and an innovator in patient engagement, partnerships, and knowledge mobilization. As a clinical psychologist and national voice for children's health, Christine creates purposeful connections with diverse groups to move research from ideas to impact, improving the daily lives of children, youth, and families. Twice named one of Canada's top 100 most powerful women by the Women's Executive Network, Christine has published over 200 articles in peer-reviewed scientific journals and is recognized in the top 2% of the world's most cited scientists in the world. As Scientific Director of the Institute of Human Development, Child and Youth Health, IHDYCH, at the Canadian Institutes of Health Research, CIHR, Christine is steering a bold vision to foster research that promotes better beginnings, vibrant childhoods, and empowered youth. She is a professor and Tier 1 Canada Research Chair in Children's Pain at Dalhousie University and faculty member in the Centre for Pediatric Pain Research at IWK Health Centre. Her acclaimed research program has helped establish Canada as a leader in children's pain research. She is also the Scientific Director of Solutions for Kids in Pain, SKIP. Emily Grunwald is a trusted voice and passionate champion for Canada's 8 million kids. As the President and CEO of Children's Healthcare Canada, a national non-profit association representing over 40 healthcare delivery organisations serving children, youth and families, she advances a vision of healthy, vibrant children and youth. Emily is also Executive Director of the Pediatric Chairs of Canada. Previously, Emily brought her strategic leadership to Solutions for Kids in Pain, a federally funded network centre of excellence, the Canadian Medical Association, and to the board tables of the Ottawa Hospital, Arnprior Regional Health and Care for Home and Healthcare Services. She is co-founder of Emerging Health Leaders and Empower Her, two national networks created to advance the development of health system leaders. Now over to Christine and Emily, and if you would like to ask questions, then please do feel free to put them in the Q&A and we will get to them at the end.
Wonderful. Thanks for the kind introduction, Miranda. I think I'm first in the queue. I just want to acknowledge how lovely it is to have the opportunity to share the stage with my colleague, Dr. Christine Chambers. I think lots of synergies between the work that we're leading, and it's always wonderful to be able to share some of the spaces that we're working in and identify opportunities for collaboration with research partners like those on the line today. I recognize some faces online, but there's certainly lots of new leaders in the room, in the virtual room for for me today. So to Miranda's point, my name is Emily Grunwald. I'm the CEO of Children's Healthcare Canada, and I'm joining our webinar today from Ottawa, which is the unceded and unsurrendered territory of the Algonquin Anishinaabe peoples. I'm going to talk to you a little bit today about some of the work that Children's Healthcare Canada is leading that we've dubbed Beyond Band-Aids. And it's really an effort to think about how we right-size healthcare systems across the continuum of care and inclusive of health research when we think about the health and well-being of Canada's children and youth. Before I formally begin, I just want to acknowledge that, it was about 2 years ago, almost exactly, that our children's hospitals in particular, but our health system writ large, was really struggling with the confluence of RSV season, flu season, and of course still COVID. And this triple-demic, as it was dubbed, really created undue and very historic strains on children's health systems in particular. We were seeing children and their families waiting over 18 hours for care in an emergency department. They couldn't access primary care services in their community. Very essential and time-sensitive interventions were being delayed. And we're still struggling as a result of that triple-demic and of broadly a health system that has been underfunded for decades. And the impacts are being felt across the country, across the continuum of care, and they're measurable. As we were championing and trying to bring attention to these unique needs of children and youth, we started using language around right-sizing and how we needed to right-size Canada's health systems for children and youth. And very reasonably, we started to get questions about, well, what does that mean? What would it look like for us to right-size healthcare systems? Where would we start? What types of investments would be required, and who needs to lead this effort? And so we really dug into that, and we dug into that with quite a bit of rigor. And so what I want to do today in the short time that I have with you is just to share with you some of the work that we undertook, but predominantly the results and how this relates to children's health research specifically. So why right-sizing right now? So as I mentioned, we've acknowledged that children's health systems, including children's health research, has been underfunded for decades in comparison to the funds that are allocated to adult health systems. We also know that investments in Canada's health research ecosystem fall short in relation to international comparators writ large, and then again, specifically when we look at investments in children's health research. What's this leading to? It's leading to worsening of children's health outcomes for those kids living in Canada. You are all familiar at this point with the UNICEF findings, which show Canada is 30th out of 38 countries internationally with respect to children's physical health and 31st out of 38 countries with respect to their mental health. We also know that the funding models that exist don't incentivize collaboration or the integration of services as children experience them, nor are they flexible in the ways that families require them. There are funding envelopes available, but they're very restrictive. They're hard to access, and they're not necessarily meeting the needs of many family members, family partners, or families with children receiving care. We also know that the highly specialized health workforce that includes clinicians, scientists serving children is depleting and diminishing. There's large bodies of work behind this. We'll dig into this a little bit, but suffice to say that we're really facing a unique challenge in children's health that flies under the radar, I think, of many of the efforts underway at the pan-Canadian level to explore health human resource strategies. We also have a growing population of children and youth who have increasingly complex healthcare needs. The access to services for children, youth, and families, and the experiences of care, both for patients and for providers, are worsening. Data gaps persist that make it difficult for us to understand and meet the needs of kids today and into the future. So there's a strong burning platform, as they say, for this work. And this was really the impetus for us to dig into this. So our goal was really to think about how do we co-define solutions. We know the problems. They've been well described by Children's Healthcare Canada and many others in our space. What can we think about in terms of very pointed solutions? So we wanted to develop concrete recommendations for integration of children's health services and health research across Canada to improve health outcomes and to guide policy and advocacy efforts, and of course, then subsequently investments. How did we undertake this? Our first pit stop was actually the Inspiring Healthy Futures Summit back in October 2023. If you're not familiar with Inspiring Healthy Futures, this was an initiative that was led by Dr. Chambers in her capacity as the scientific director of IHDYCH at CIHR, myself wearing both my pediatric chair's hat and Children's Healthcare Canada, and our colleague Lisa Wolf at UNICEF Canada, where we were really grappling with what do we need to do differently to affect change for Canada's kids. So at this inaugural in-person summit back in October, we had the opportunity to tease out a couple collective of priorities that really resonated across sectors. It's important to let you know that the folks in this room weren't just from health and weren't just from health research. They were from education, social services, justice, a good number of youth and family partners also involved in this work. And so it was precedent setting insofar as we were able to come together, park our individual organizational interests, and say, here's what's best for kids. These are 2 of 6 priorities that emerged. So the first was thinking about how do we right size as a collective priority of organizations with an interest in children and youth? And then how do we think about supporting a fully integrated collaborative research ecosystem that enables sustainable discovery science, shapes improved health outcomes, and informs equitable child and youth-centered policy? Christine's going to talk a lot about that latter priority, and I'll share with you the work that we've been doing with the right sizing. Following the Inspiring Healthy Futures Summit, we engaged in a series of virtual roundtables over the period of about 3 months. We had the chance to connect with Children's Healthcare Canada members and non-members, leaders across the children's health ecosystem, our family network, as well as members of the Young Canadians Roundtable on Health. And we had several focused conversations. So whether it was around hospital-based care, whether it was around populations of children, for example, those with medical complexity or those suffering with mental health disorders, and also the child health research community. So quite a broad series of conversations that helped us sort of diverge our thinking and then bring it together to be very focused in terms of our recommendations. So this is just a snapshot that shows you some of the specific leaders who are engaged, as well as the total numbers of influencers who had the chance to participate in these sessions. So what did we hear? We very quickly landed on a shared vision, and that was around accessible, equitable, connected healthcare services that are designed purposely for the needs of children, youth, and families in Canada and underpinned by best available evidence. We identified what would be building blocks for successful health systems transformation in the children's space. So first and foremost, we agreed that it was long overdue to think about how we earmark or create dedicated funding streams for children's health systems, including children's health research. And there is precedence for this. Most recently in British Columbia, we saw the federal and provincial ministers of health agree that they were going to create earmarked funding for seniors' health care. So if we can do that for seniors, can we do the same for children and across all jurisdictions to ensure that money that is invested and intended for children's health is used for that purpose? Second, thinking about how do we lean into strategies that are underway with respect to health data and make sure that data that's relevant in the children's health sector is collected in a uniform and accessible way across the country. And third, acknowledging the unique needs and the unique specialty of our workforce serving children, we really need to put emphasis on that specific population of the workforce in initiatives that are underway. It's our experience with other HHR strategies being led by the federal government or in various jurisdictions that they tend to think about children's health as a single specialty or a single discipline, when we know, in fact, it essentially replicates the adult system, and a cardiologist who serves adults isn't the same as a cardiologist who serves children. So we really need to make sure that the children's health workforce is counted appropriately. Above and beyond these building blocks, we identified roles for 4 different audiences, I suppose. So the first is thinking about the federal government. The second, recommendations are provincial and territorial government focused. There's a role for the children's healthcare sector. So that means healthcare delivery organizations that are serving children and youth have a role to play in this transformation, as do organizations like mine, and as does the philanthropy sector. So with respect to the federal government, we saw 3 specific opportunities for them to demonstrate leadership. The first is thinking about how do we coordinate all the different efforts that are underway and orient them towards a common goal. So this idea of a national strategy for children and youth would go a long way to say to constituents across the country and to say to children and youth themselves that they are important and that they deserve our attention and our focus to improve their health and well-being. To support the implementation of this strategy, we're calling for a chief child health officer, someone who's intimately familiar with the children's health environment, who understands what it's like to deliver care in a large urban tertiary center, but also in a rural or remote community, and understands how community partners engage with tertiary centers in a way to deliver seamless care. This child health officer would also be a real champion for children at all levels of government and help to identify where there are opportunities to spread and scale innovations. Of course, the government also has a role to play in the context of the health transfers to ring fence the funding for children's health services, as I mentioned earlier, which includes a focus on children's health research. As the funders and those most responsible for the delivery of healthcare for kids, the provinces and territories have quite a few opportunities, we think, to improve how care is delivered and the timely access of care for kids. I'm not going to go through all the recommendations. I believe there were 6 in total for provinces and territories to consider, but suffice to say they play a really important role in this strategy as well. The child healthcare sector, so these are the organizations that are delivering care. We're encouraging them to think about new ways of partnering to leverage the resources they have available to them, whether those are human resources or financial resources, to think about how they can enhance local capacity and how they can better respond to the evolving needs of children and youth. Again, if you were to take a peek at the Beyond Band-Aids report, you're going to see upwards of 17 recommendations for children's healthcare centers specifically. The role of child health advocates, it really comes down to purposeful partnerships. So the opportunity to convene, for example, Children's Healthcare Canada and stand beside the Canadian Pediatric Society or the Canadian Association of Pediatric Nurses or any of the other organizations who have a unique need on children. I think it's incumbent on us to, quite frankly, get our act together and to agree on some shared priorities. And that was the beauty of the Inspiring Healthy Futures initiative, is it did convene many of those partners to help us hone our messaging and be more effective in our advocacy. I'm just going to say a couple more words before I pass the baton to Christine. So it's important to acknowledge that a lot of this work, especially as it relates to the focus on research, is being amplified by other national organizations we're working in lockstep with. So just recently, I believe it was about 2 weeks ago, Healthcare Can released their national vision to transform health research in Canada. The recommendations are quite high level, but you can see how there are some synergies in terms of the focus on the workforce, thinking about how we reestablish ourselves as a global research and innovation hub, and how we shorten that distance between or the space between what we know and how we practice or how we advise for policy. So lots of great synergies here. Another real champion in this space is Research Canada. You can see their focus in budget 2024. Again, looking for meaningful and sustainable investments in health research to help us to advance what we know and how we practice and how we are serving Canadians, including Canadian children and youth. So if I think about taking a step back and looking at the 35 of us in the room today, how can you support this effort to help us right-size children's health services, including the research that underpins much of what we know and how we act? Engage. Look at some of the social posts that are available online. There's lots of opportunities and lots of specific messaging that's relevant to the health research community, and for you to lend your voice, share why it's important and what your call to action would be incredibly meaningful. Thinking about how you collaborate with your organization to invite in tours of elected members of government, whether those are provincial or federal government, folks who have had the chance to walk through and see the incredible research that you're leading, have a much deeper understanding and can be much more effective champions for your work. And it's win-win. I think it's a great opportunity for you to showcase what you're doing, but it also gives them that sort of elevated awareness of what their opportunity for action is. Share examples with us about how health research is enabling improved care or care outcomes for children and youth. We're looking for examples to showcase at Children's Healthcare Canada, and to think about how we can collectively elevate health research priorities in the context of an election. I just had the chance to meet with the Conservative government policy lead, and their response is, we respond to what we hear at the doorstep. If we don't hear someone talking about health research, it's not going to make our priority list. So take that opportunity to think about how you can create some messaging and momentum around why research is so critical in the Canadian context, and what our federal government can do. I say federal government, there's lots of provincial government or provincial elections happening as well, and that's equally an important opportunity. Encourage you to follow all of our work on social at Child Health Can, and I'd be happy to take some questions after we hear from Christine.
Great. Thanks, Emily, for the fabulous presentation. It's always great to hear you speak, and great to hear the overview of all of what your organization is up to, in particular, your inclusion of child health research. So my name is Christine Chambers. I'm based at Dalhousie University in Halifax, which is located in Mi'kma'ki, the ancestral and unceded territory of the Mi'kmaq people. And it's really an honor to have been asked to speak at this webinar today. And actually, I'm just going to ask Laura and my team to, there we go, bring up the slides. Perfect. So it's really an honor to be here and presenting alongside Emily Grunwald, who I've had the pleasure of collaborating with in various capacities over the last number of years. And every time I saw the words including child health research on her slides, it really warmed my heart, because often, people don't think about research as a must-have. Often people think of research as a nice-to-have, or something that happens on the side of other priorities for health and well-being. So we're really grateful at CIHR's Institute of Human Development, Child and Youth Health to have worked so closely with Children's Healthcare Canada and others across the child health space to make sure that children and research, and when I'm talking about research, the mandate of our institute covers all of human development, child and youth health, that this is really seen as an integral part of healthcare. It's also really an honor to be here today presenting as part of the CHEER webinar series, because as Miranda mentioned, we are really very pleased to be the co-funders of CHEER alongside our colleagues in the Institute of Genetics, and really see the work that CHEER is doing to streamline and address efficiencies, in the health research ecosystem to be so critical. So thank you to all of you involved in CHEER. We know these are not easy tasks, but we're really grateful for the leadership and innovation and all the lessons that are being learned throughout this process. So on my next slide, you'll see a little bit of an overview of who we are at CIHR. So what is CIHR? We are Canada's federal funding agency for health research. CIHR has roughly a $1 billion a year budget that is distributed amongst its strategic and open competitions. The real kind of lifeblood of health research in Canada are the project grant competitions that occur biannually in September and March. But we in the institutes oversee a portion of the strategic funds that CIHR receives, and create opportunities for the research community to apply and seek funding for various initiatives. So you can see here on the slide that we're one of 13 different scientific institutes at CIHR, but we intersect and work very closely with the leadership of all of these different institutes. The institutes are virtual, so they follow the scientific director wherever they are based. And so, as I mentioned, we're based here in Halifax and are hosted by Dalhousie University. On the next slide, you'll see that our institute has a small but mighty team that is based in Halifax, Toronto, and Ottawa, as well as our advisory board members who are based across the country. And this is a photo of us at a recent event in Vancouver, representing different career stages, different geographies, different areas of research. We also work closely with our colleagues in Ottawa, including the senior leadership team at CIHR, and our Youth Advisory Council have been very active over the years in providing input on priorities and helping to provide additional awareness for health research. Next is a slide that gives you a bit of an overview of our strategic plan that we launched in 2022. Our vision is better beginnings, vibrant childhoods, empowered youth, research that makes a difference. And our mission is really focused on fostering growth and equity across the human development, child and youth health research community, with the goals to advance science, promote knowledge and ways of knowing, and addressing the needs of children, youth, and families in Canada, as well as globally. The next slide provides an overview of our key areas of focus. Again, we have a very broad mandate, so we address issues related to better beginnings, vibrant childhoods, and empowered youth, and acknowledge that these areas of focus exist within a complex and important context that includes families, communities, and the systems around them. And our strat plan was released in 2022 to build on the work that we led with Children's Healthcare Canada and UNICEF and the Pediatric Chairs of Canada in Inspiring Healthy Futures, and Emily just gave a great overview of that work. Our strategic plan at IHDYCH was really a deeper dive into the research specific priorities and needs of the research community. On the next slide, you'll see our three sort of overarching priorities, which are to convene, to champion, and to capacity build. And if you visit our website and look up our strategic plan, you can learn more about each of the sort of strategic activities, as well as our measures of success and how each of our activities kind of relates to the broader picture of child health and well-being. On the next slide, you'll see that we're really committed to communicating our impact and having transparency in our communications. So on November 20th, each year, National Day of the Child, we release our annual Making a Difference report, and we highlight three different key initiatives, so one in each of our key areas of focus, and kind of highlight, what have been some highlights from the last year. And we will be releasing our next 2024 Making a Difference report next week. So you can certainly look for that on our website or via our different communications. So just a note on the next slide about the importance of research and, why Emily sort of had that, including child health research, but why is it so important? So really, research really is the underpinning of knowledge and knowledge generation. It's really important to, mobilize knowledge when we have it, so that it actually improves the lives of children and families. But research really, is needed at all levels across all pillars of research, as we would refer to them at CIHR, in order to improve care. And we've seen dramatic improvements in quality of life and reductions in mortality over the last 50 years. And that's in large part due to health research. Because of health research, children are healthier and safer today and will become healthier adults. And I'm a big fan of the 7 great research achievements that were highlighted by the American Academy of Pediatrics. And I often use these to communicate just about the importance and value of health research. And so some of those include preventing disease with immunization, reducing sudden infant death with back to sleep, dramatically declining mortality rates for acute lymphoblastic leukemia, saving premature babies by helping them breathe, preventing HIV transmission from mother to baby, increasing life expectancy for children with chronic diseases, and also saving lives with car seats and seat belts. So those are just 7 incredible achievements, and also demonstrate how the full spectrum of health research, from basic science discovery all the way through clinical research to health services and implementation research, how it all kind of works together to help, revolutionize care. On the next slide is just an example of some of the initiatives that we fund at CIHR. As I mentioned, the majority of our budget does go through the open project grant competition at CIHR, and the institutes are charged with a portion of the CIHR strategic budget. And I'll tell you, it's a small budget, and it hasn't really moved much over the last 20 years. It's a budget of approximately $8.6 million per year per institute. So at IHDYCH, we really work to identify gaps and design funding programs to help address these gaps. And there's two examples here for the mental health in the early years, or MIGHTY initiative, which was in response to a report from the Mental Health Commission of Canada. And through partnership with other CIHR institutes, we were able to invest $6.5 million to fund 5 implementation science teams. And through a partnership with the Public Health Agency of Canada, we were able to co-fund a knowledge development and exchange hub to facilitate connections amongst the teams and facilitate the uptake of research evidence into practice and policy. Another example, our Healthy Youth Initiative builds on work from the Government of Canada's Youth Secretariat and aligns with a recent Lancet Commission on adolescent health and well-being. And so this initiative, we've already funded 2 rounds of Catalyst grants, 30 grants for roughly $3 million. And our teen grant competition is now open with a registration deadline of December 10th and a full application deadline of February 4th. And importantly, these teen grants include pools for Indigenous youth health, Two-Spirit, trans, non-binary, and other gender diverse youth health. And there's also one focused on reducing social inequities. And of course, I mentioned at the beginning that we fund CHEER, and also, really grateful to see the fantastic work that is happening through the CHEER initiative, and I think is really informing a lot of other larger scale, conversations that are happening around streamlining research ethics more broadly outside of the human development, child and youth health space. On the next slide, you'll see that another way that we build capacity is by supporting early career researchers through a suite of programs. We love our acronyms at CIHR, so here's a few more. The Health Research Training Platforms, HRTPs. There's a couple that we fund in our mandate area, ENRICH, AVA, and GROW. There's also our Early Career Researcher in Human Development, Child and Youth Health competition. We contribute funds to CIHR's Health System Impact Program at both the fellowship and early career levels. We've been proud for over 20 years to have a partnership with the Sick Kids Foundation for new investigator research grants. We also fund secondary analysis through our analysis of existing data, a competition. And we've also recently launched an implementation science chairs program. So this gives you an idea of how we're supporting people at different places along the career continuum. On the next slide, you'll see that we are also really deeply committed to embedding equity, diversity, inclusion, and supporting an Indigenous path in all of our activities. And so we do this by ensuring diverse perspectives on panels and at events, and by having dedicated funding pools to support research in these areas. On the next slide, we'll talk a little bit about research culture, and there's been an increasing movement kind of internationally towards rebuilding what we think of research excellence and research culture to one that is creative, inclusive, and honest. And the reality is that current practices in research prioritize outputs at almost any cost. And that creates a hyper-competitive environment when you couple that up with what are generally pretty low success rates for certain grant competitions. That really can mitigate people's well-being and or damages people's well-being and undermines the quality of research. So it's really exciting to see movements, again, nationally and internationally, to sort of reimagine what research excellence is. So in 2020, CIHR signed on to the San Francisco Declaration on Research Assessment, DORA, which is a global initiative to support the development and promotion of best practices in assessment of scholarly research. And in 2024, CIHR released its Research Excellence Framework to ensure that agency-funded research is not only scientifically excellent, but ultimately leads to impacts that benefit all people in Canada, including those historically underrepresented in the research system. On the next slide, I'll just speak a little bit more about what we mean sort of by research excellence. And CIHR's concept now of research excellence is one that is holistic, is adaptable, and is also evergreen. And we're really pleased to have seen a commitment in this document that CIHR released on implementing CIHR's research excellence framework to developing an agency-wide policy for inclusion across the lifespan to increase equity in CIHR funded research. And this has been something that we at IHDYCH and our colleagues at the Institute of Aging have been working on for the last number of years to mirror an inclusion policy that the NIH has had for a number of years to ensure that children and older adults are not systemically omitted from research. The next slide talks a little bit about how our knowledge mobilization activities work at CIHR and through IHDYCH. And so, you know, we are really happy to promote this competition around called IHDYCH Talks. And through this competition, we have 3 different types of outputs that people have submitted: knowledge mobilization tools. There are videos, which this competition has been traditionally focused on for the last 10 years. But for its 10th anniversary this year, we broadened the inclusion to include podcasts and infographics. So voting is open right now until the end of November. So you can click on this QR code or visit our website and be taken to a list of all of the incredible knowledge mobilization tools and products that are there, and vote for your favorites. And I'll conclude with a slide just around how you can connect with us. If you aren't already receiving our monthly e-bulletin, we really strongly recommend that you sign up. We use it to share all of the news about our funding opportunities, as well as you know, any other important news from CIHR that's relevant to our research community. We also have links to our strategic plan on this site, as well as ongoing initiatives and other investments. So please connect with us. And with that, I will close my presentation, but looking forward to the conversation around right-sizing research for children.
Thank you so much, Christine and Emily. Those presentations were absolutely wonderful. So we have a question in the Q&A to get us started, and this question is from Megan Allore. How do you envision the research community can engage community hospitals in pediatric health research as part of right sizing? For example, inclusion in decentralized trials.
Yep, happy to jump in there.
I'll throw that to either of you.
And then Emily, if you want to chime in as well. I think it's a great question, and you know, really important quality research happens not just in the major children's hospitals, but there's a role for everyone, right? So I think that there is an increasingly a movement towards community-based research, and a lot of the work that we are funding through our various initiatives is not necessarily housed in the traditional research hospitals. We've supported through our Healthy Youth Grant, for example, you know, various teams who are out in the community or who are engaging in research in smaller community settings. And I think there is a space for different types of trials, different types of engagement. So I think it's all about finding a role for all centers. And the reality is that, you know, we're too small. Our, you know, a population of children is enormous, but our community is small, that it's hard to answer a lot of the questions alone. It's why I think research networks, and I'll give a shout out to MyCERN, the Maternal Infant Child Youth Research Network here, who I know play a driving role in CHEER as well. But that kind of network is so important because it helps people be connected with opportunities and be connected with research from wherever they sit.
Thanks, Christine. I would just, from a Children's Healthcare Canada perspective, I guess there's a couple different ways that we do try to connect opportunities of relevance to our members. So taking just a quick step back, if you're not familiar with Children's Healthcare Canada, our members are healthcare delivery organizations that are serving children. So all 16 of Canada's children's hospitals, but also community hospitals, rehab centers, respite, palliative care providers. So really that full continuum of care for kids, less primary care. So we do a lot of work within the context of that membership to identify opportunities to showcase great work that's ongoing and to invite participation of other centers as it is appropriate. So our Spark program hosts webinars every other week, just like this, showcasing evolving or emerging research and sharing opportunities to get involved. Same with our newsletter, which is produced on a bi-weekly basis as well. So we do try to create visibility of those opportunities, but we can only work within the construct of who our members are. So that is a conversation that we're having with some of the research leaders across the country, is how do we even expand that that community so that we are able to leverage the relationships or build new relationships to optimize those opportunities, just as you've identified. So great question. Thank you very much.
Great. And Laura has popped into the chat where we can connect with CIHR. So another question for you both. As you know, CHEER focuses on making efficiencies with research ethics where possible in pediatric research. When contemplating the integration of research with healthcare, can you see the role or the composition of the REB needing to change?
Yeah, that's a really interesting question. And, I think it would present an opportunity, right? I mean, I know that different REBs function in different spaces. So where I'm based in Halifax, there's an REB at our university, but there's also an REB at the IWK. And shout out to that REB. As a researcher, it was always such a positive experience to apply to an REB that really understood children and had that kind of clear focus and mandate. But I think for sure there's huge opportunities to re-envision. And I think a lot of our approaches to research ethics, and I've seen the pendulum swing from one way to the other, right? Like, so when I started my research career as an 18-year-old summer student, like the consent forms were like a paragraph, right? I think I still have my first consent form. And, then the pendulum swung completely the other way. And, we've got 15-page consent forms. And, how does that actually align with the spirit of what's behind consent, right? And so I think this movement towards greater efficiency and integration and streamlining, I think is going to land us in a great space. So I think there's lots of opportunity to broaden the mandate and broaden the composition of REBs. And I think, we're at a tipping point of thinking differently about research. Again, I started by talking about how research is this thing over here. And this is not my quote, and I can't remember who I got it from, but I love it, that research is care. It is, it should be seamlessly integrated into what we do within health centers. And so I think that's part of the future as well.
And Emily, did you want to chime in there?
I don't think I have much to add on that one, Miranda, but Christine's response sounds quite reasonable to me.
Okay, well, here's another one for you. So the first event of this webinar series that CHEER's hosting was on the topic of equity, diversity, inclusion, and accessibility in research. And we know how important that is for expanding the impact of research and generalizability for better serving a diverse Canadian population. So where do you see EDI values supporting right-sizing health systems? And I know you both kind of touched on these in your talks.
Maybe I can jump into that one just to kick things off. I think that's a really important question. And Miranda, it really underpinned our design of the engagement process for our Beyond Band-Aids work and for the Inspiring Healthy Futures that came before it, in terms of who are the audiences that don't necessarily have a platform or who aren't usually invited to the conversation. How can we make sure that they have a way to engage in this? And I have to say, throughout both processes, the sophistication of thought and the openness to the conversations that the youth that we were able to invite into the room who could make that opportunity happen, it was incredible. It was probably the most impactful thing to emerge and really reminded us how valuable their perspectives and their experiences are and how important it is for us to consider that in that path forward and really identify those youth partners and families and other equity seeking populations as priority partners in this work. They are first and foremost the populations that tend to have the worst health outcomes, and that's where we have the most ground to make up, I think, in our healthcare system. So that was really important, and I think is important as we can think about considering where to from here. So that was foundational in all of that work, and I hope and expect it will be going forward as well.
Yeah, and I can jump in to offer, a CIHR perspective. And I think, these are issues that CIHR takes very seriously. So they convened two very influential committees. There was an anti-racism committee for health research and also an anti-ableism committee who have released reports with very specific recommendations, which the agency is following. I also just will say that, one of the biggest levers from where I sit is how we spend our money, right? So it's one thing to say that we have a commitment, but as a funding agency, it really comes down to how are we spending our dollars? And so, we were really pleased to be part of something that CIHR launched in the last year or two, led by my colleague Charu Kosick, who's the scientific director of the Infection and Immunity Institute at CIHR, called READY, which is Research Excellence Diversity Inclusion Award. And it's funding, I think she was able to secure over $40 million various partners to support early career researchers who are racialized. And the first competition was on, I'm gonna get this wrong right now, but anyhow, it's targeting particular groups. So Black people and racialized women, there it came to me. They're going to be releasing a second wave of this competition to help support them into transitioning into faculty positions. I think, again, I mentioned in my presentation the specific pools so that we ensure that in the competitions that we launch, that there is an opportunity to support and fund Indigenous health research, as well as research, with an equity, diversity, inclusion lens. And I think it's so important that when we're talking about EDI, that we continue to make sure that the tables that we convene, because I think this is another lever that we have as leaders, are diverse, right? So really grateful to our very diverse Institute Advisory Board and also our Youth Advisory Council, who bring with them, lots of different lived experiences and background and ideas.
Thank you. And I was just popped into the chat about some information about that READY program. So Emily, you spoke about worsening access for healthcare. Are you able to tell us sort of why that is? I imagine this is probably going to be quite multifactorial.
For sure. So, at the offset of the presentation, I talked about the impact that triple-demic on children had back in November 2022, despite some investments, despite efforts, very focused efforts to tame the queue that children and youth and families were experiencing. We're not that much further ahead. And it is systemic underinvestment and the workforce being a big part of the challenge. There's no quick fix to train the next generation of highly specialized healthcare providers caring for children. We did some really interesting work, Miranda, last year with the Conference Board of Canada, and we were trying to put a price tag on that wait, right? We know that children and youth are waiting in some cases over 2 years, for example, for mental health care services. They're waiting over 18 months for a surgical procedure. And we know that as they wait, their conditions often worsen. As they wait, they often require additional healthcare services to mitigate pain, to support the, rehab in between. So there's a lot of additional services and supports required. Often family partners have to forego employment income to stay home and care for a child who might not be able to go to school in the same way that their peers do. So all that to say is we worked with the conference board and really tried to measure the costs of waiting for care. And we looked at 3 specific case studies. We looked at children seeking or who are waiting for a surgical intervention. And in particular, we looked at scoliosis. We looked at children who are waiting for mental health services related to anxiety and depression. And we looked at children who are awaiting a diagnosis and intervention related to autism. And probably as no surprise to anyone on this line, the impact of those waits to the healthcare system measured in billions and trillions of dollars. So those are dollars that we are spending in our healthcare system today because children are waiting too long for care. There was an additional metric that looked at what's the human cost for children and their families waiting for care. And again, the costs are directly borne to children and families were in the millions of dollars. So it's a pretty compelling argument to make to say that, we need to think about investments upstream. We need to make sure that children have timely access to these services, not only because because it's the right thing to do, but also because we're losing all that revenue that we could be investing in other ways in our healthcare system by spending it because we have no alternative at this point. So, that's an argument that we're trying to make to provincial and federal governments to encourage them to get upstream, to think about how do we prevent some of these chronic diseases that we're seeing increasingly prevalent amongst children and youth. How do we prepare children and youth for healthy, thriving lives? How do we support them become healthy, thriving adults, and therefore healthy, thriving seniors as well? So lots of work to do there, but just thinking about different ways to communicate that story to decision makers.
Yeah, and this is something for you both, just kind of going on from that. What do you think some of the challenges for right sizing is in a multi-jurisdictional environment such as Canada?
I mean, I would even take a step back and say, what are the challenges of right sizing in general? And there are a lot of competing priorities in our healthcare care system right now. There's a lot of challenges that we're facing, not only across the continuum of care, but across the lifespan. And so I do think it is incumbent on us, and this gets to the idea of purposeful partnerships and really communicating and coming together with what are 1, 2, or 3 priorities that would really make a difference for children and youth. And the more that we can align that messaging and those priorities, I think the more effective that we'll be in our advocacy. I am encouraged. We are seeing historic investments in ways that we haven't before. We're seeing conversations happen about the children's health and health research space that we haven't seen before. And so I think we have this window of opportunity. We need to leverage it to the max, and we have to think about how do we engage new governments as they cycle in so that we don't lose ground, whether it's a federal government or whether provincial governments. We've worked so hard to establish these relationships. We've worked so hard collectively as a community to tell this story, but there's still a lot of work to do.
Yeah, and I'll just build on that, it's interesting for us to reflect on sort of where CIHR sits in all of this too, and that we are, Canada's federal government agency, right? So sometimes people will say to me, well, I hope you're advocating, I hope you're lobbying for research investment. And I have to remind people, I can't, because I actually am part of government. I'm part of working, within this organization. And so I think that's why the points that Emily raised, I loved her call to action at the end of her presentation around what can you do? What can researchers do? What can research organizations do? What can funded research networks do, right? Is to tell your story, to engage. And at CIHR, make it easy for us to tell your story. We share a lot of stories about funded research teams. If you think we should write one about yours, let us know. Laura is joining on the webinar today. She's our communications and engagement manager. I loved what Emily shared around, does your MP know who you are and know how many jobs you're creating with your funded investment? I think it's so true that if Canadians don't see and feel the impact of health research, they aren't going to mention it when, the politician comes to their door, as Emily framed. And I think that research, I think, has gotten a bad name throughout the pandemic, right? It's this era of misinformation that we're living through. It's fascinating because, I went over some of those great achievements that we take for granted every time that we put, a seatbelt on our child, or that we put them to sleep a certain way, that, research is what helped get us there. And so, keeping that fire burning, making sure that we're telling stories, that we're sharing impact. And one stat that I didn't share in my presentation, but when you compare the level of investment that, say, Canada has and CIHR versus what the American government invests in NIH, there's a huge difference, right? So on average, NIH funds per person roughly about $135 per person, or the government supports that level of investment. That's US dollars, but in the Canadian context, it works out to be roughly 25 Canadian dollars a person. So there's a big difference, and that's just some numbers to bring to life sort of what Emily shared around, how there is, not a strong equivalency. And so I think with all of the competing demands, the jurisdictional issues, it's easy for health research to get lost there. And so I think as much as we can weave that together, so that it's seen as part of an essential package of taking care of children and advancing care, I think we'll be all in good shape in terms of right sizing.
Yeah. And just going back to that number with investment, does that number actually go down for children? Is there data on that? Does it go
Good
up,
question.
maybe?
Well, and so one of the things that I think Emily and I didn't really get into too much detail about was that there was a Senate HESA committee on children's health, and their report was released in May with number, I think it's 27 different recommendations, and one of them was around research and data. And then the government issued its response, and there is a number quoted around sort of how much CIHR has invested in human development, child and youth health research. I think it was like $1 billion over the last 10 years. So there are some numbers, and we're leading an analysis of that as well. Because again, we at IHDYCH fund a small portion of the incredible research that happens across our community. But in terms of, what that number could look like just specifically for human development, child and youth health, it's a bit uncertain. But I want to compliment Emily and her team on the Beyond Band-Aids reports and the recommendations. And I think it's so important, to present with a cohesive voice and agreed upon priorities. I think there are so many demands and needs and different groups, and I see this with researchers all the time. I call them passionately niche, right? Like everybody is so passionate about the particular issue they study, they have to be, but that can be kind of noisy and confusing when you've got hundreds of people each taking forward. Let's combine this into cohesive messaging about the importance and value of children's health research.
Thank you. And just as we're coming to the end of our time today, I just wanted to get a final thought from you both. And Emily, you spoke about shared priorities for like stakeholders involved in achieving like right sizing across our health systems. And from you both, and I'll invite Emily to go first, what would be your top priority for achieving right sizing for people to come together?
It's a great question, Miranda. Honestly, I think still to this day, despite our collective efforts, one of the biggest challenges we have is just there isn't general awareness of how children and youth are struggling in this country, right? I think that opportunity then for the federal government to say 30th or 31st out of 38 isn't good enough. It's embarrassing. We are a very wealthy nation with all the resources required to affect meaningful change for kids in this country. And so for us, what that would come down to is this idea of a national strategy that sets a target, a goal, timelines, and how are we going to measure what the outcomes are for children and youth across this country in a consistent way. So I'd love to see the federal government come out and say, we want to be a top 5 performer internationally according to XYZ report card by 2040. Provinces and territories, here's what we expect of you, A, B, and C. And you know what? There's going to be different priorities and different challenges, different resources in each jurisdiction. And I respect that. But I think we need to be rowing towards the same finish line and thinking more collectively about what's working in each jurisdiction. How do we know that? And how can we share that expertise so that others can benefit from it as well? So for me, it would come down to saying it's time to make kids a priority. How are we going to do that through a national approach?
And Christine, your priority.
I mean, gosh, there again, it's hard to eliminate. But I think, making sure again that research is part of that right sizing. And I think that, there's an opportunity for us in children's health. We're a great incubation space. Like we shouldn't be having to right size. We should be the space where people are trialing everything. And I mean, Cheer's doing that, right? Like they were innovating and streamlining research ethics, in a way that is meaningful for the whole broader health research community to learn from. And I think we could do a lot more of that in pediatrics. We're just the right size. We've got the right connectiveness. So that would be, let's not right size, let's over invest in child health research, because I think there's a lot of lessons to be learned.
Thank you. And that's a really wonderful thought to end on. And I would like to thank you both for your presentations. Very, very thoughtful insights. I think we can all go away from this feeling inspired to achieve the best healthcare for our kids. And I'd like to just thank everyone who attended and came to our webinar. It's great to see so many from the community coming together for events such as this. And our next webinar is going to be next year in February. And there's a few links in the chat just to various things that we spoke about today. So if anyone wants to quickly grab those, and we can make those links available as well, just when we post the materials from this webinar. on our website. So thank you, everyone.
Thank you.